Okay, good afternoon, everyone, and thank you for joining MHPA today for our Webinar Wednesday series. My name is Patrick Corp, and I'm MHPA's Director of Membership and Partnership Engagement. I'd like to take a quick moment and provide a brief introduction on today's webinar. Today's presentation is in listen-only mode. If you have any questions throughout the webinar, please enter them in the Q&A section located at the bottom of your Zoom screen. We really encourage your participation, so please feel free. We love questions. Our presenters will address each one at the end or during the presentation if possible. The webinar slides are available upon request from our presenters. You'll receive an email later today or tomorrow and just hit reply and request them. You'll also find recording of the webinar itself on MHPA's YouTube channel, and that'll be up later this evening. You'll also get it in the email. And I would like to welcome and thank Rina Brar-Prayaga, Behavioral Data Scientist and Advisor to Impulse Mobile, and Melissa Palladino, Strategic Account Director, also with Impulse Mobile. I'd like to thank Impulse for being a great silver partner, has always been a wonderful support of MHPA and our members. And today they are presenting using Fotonovelas to increase member engagement and reach wider populations. And with that, I'm excited to turn things over to Rina and Melissa.
Thank you so much, Patrick, for the warm welcome. Really appreciate it. Hi, everybody. It's really nice to be here with you today. Welcome, and I'm so glad that you could join us to talk about Fotonovelas. For those of you who may be new to Impulse Mobile, just very briefly, we engage in health engagement. We reimagine health engagement, and we always have the member at the core of whatever we do, everything that we do, and we have conversations with them. And it is all to drive health outcomes for them that deliver significant health activation for them along their journey. I am a strategic account director, as Patrick mentioned, at Impulse Mobile, and my relationship with Fotonovelas, I work with some large national enterprise health plans, including Humana, Kaiser Permanente, some of the Blues, and I have worked in coordination with a lot of these clients to be able to create campaigns around their needs to use Fotonovelas in this very interesting time that we're in. It's a very interesting tool. And so I've worked very closely with Rina to help develop the campaigns, work with the clients to launch them. So it's been very, very exciting time. And I'm delighted to be joined by Rina. And Rina, would you like to introduce yourself?
Yes. Hi, everyone. I'm Rina Brar-Prayaga. And yes, I'm a behavioral data scientist, which means basically that I work at the intersection of behavioral science and data science. And the purpose very much of my work is to build health literacy, to influence health beliefs, to nudge members towards more healthy behaviors. So I would say those are the focus areas. And this approach of combining behavioral science and data science helps us to create more tailored, more relevant, more engaging messaging. And it draws on a wide range of data, including demographics, psychographics, and actual member response data. Very excited today to be joining Melissa and the rest of you as we share a few experiences and outcomes with mobile Fotonovelas.
So this is what we're going to talk about today. We are going to tell you what Fotonovelas are, and it's particularly what mobile Fotonovelas are. Some of you may be familiar with Fotonovelas as a concept, but not in a digital format. So we will talk about what that looks like. We'll talk about why this is especially relevant right now, and also how to deploy them, what it means to set up a campaign with a Fotonovela, what works, what doesn't work. We will share what we have seen over the past 12 to 16 months in terms of best practices. And of course, if we have time at the end or during, if you have any questions, please go ahead and ask them in the chat, and we will we'll answer your questions too. So Rina, I'm going to pass it over for you. Maybe you could talk a little bit about how we sort of started dipping our toes into the water of Fotonovela creation and use.
Yeah, so let's start with what are Fotonovelas. They're basically visual stories. They've been used in other cultures in print format for decades, particularly true in Latin America. And we're using them in a similar way to provide basically more context about a health issue. And then in the process to also address concerns, to address barriers. But we're doing this through characters in an unfolding story. Along the way, we're of course building health literacy, building knowledge. The difference between the way fotonovellas have been used in the past is that we've created digital versions of these stories, and we're tapping into a mobile channel. So we're taking the learnings and the insights from print fotonovellas that were more like a pamphlet or a magazine with stories and characters, and then we're applying them in the mobile space to make them more accessible on your phone, and also extending the reach significantly at a much, much lower cost. The characters, as you will see, are people just like you and me. They could be someone you know, a friend, a family member, and the intention is basically to draw you in and make you feel like scrolling to the end of the story. So then the question is, why are they relevant now? Well, as most of us know, about 80 million Americans have low health literacy, and this leads to disparities in healthcare access. So part of what we do at Impulse is we are very committed to building health literacy, and we realized this was particularly important with the pandemic because limited health literacy has been associated with lower adoption of protective behaviors. So as you can see on the next slide, the messaging needed to include hand hygiene, vaccinations, basic self-care. At this point, we weren't talking vaccines. This was very, very early in the process where we put together our first fotonovella within 2 weeks of the pandemic and launched it in early April. This is April 2020, where most of us were still trying to wrap our heads around what was okay and what wasn't. And the focus, as you can see here, was very much on clean hands, not making too much physical contact, what was okay, what wasn't. At that point, hand sanitizers had rolled off the shelves in the supermarket. So we were focusing very much on basic self-care measures, understanding that there was a disproportionate impact. Even then, it was already clear that there was going to be a disproportionate impact of the pandemic on underserved populations. So we wanted to do that make that extra effort to reach out.
It's amazing.
We then moved on. Yeah, go ahead.
Oh,
Yeah.
I'm sorry, Rena. I was just thinking it's amazing to think that there was a time when we weren't even thinking about masks yet. Way back at the beginning, it was all elbow bumping, not a mask in sight.
Yeah, we didn't know at all what lay ahead. And so we went through a lot of phases here. What you see in this next one is probably about a month or two into the pandemic, where we realized we were in this for the long haul. This was the stage where it was no longer a few days or a few weeks, but probably months. Many people found themselves staying at home, juggling work and kids, basically facing very stressful, very uncertain times. We anticipated that this was going to happen. So we rolled out another program just a month after the first one, which was a social isolation program in which we used a combination of text messaging and fotonovellas to help people basically feel less alone, to provide ideas, links to resources, activities that could be helpful during this phase. I lost track of how many people told us they clicked on this link to help them learn origami in the middle of the pandemic, and they loved it. And that was all ages, including, in this case, it was a population that had older and disabled members as well. But there were simple reminders, things like don't check the news too often, use Zoom calls. Some of that made its way into text messages. Much of it made its way into fotonovellas. This is just a single frame here, or a single story, but we had 6 separate stories within the fotonovella. In this one, we're trying to just get people to leave the house, to be outdoors, emphasizing it's important for their physical and mental health, even if they have limited mobility. Okay, so looking at engagement, this was for us one of the first of its kind. And so it was very exciting to see the engagement levels, which were very high for both programs. And a consistent theme in the free text responses that we got back after people viewed these fotonovellas was that they felt their health plan was going out of the way to be there for them at a very difficult time, and they appreciated this. We had thousands of members who responded telling us how they were staying healthy, how they were managing to be positive, and how they got ideas or even hope from the text messages and photonovellas that they received during this time. Basically, they felt less alone at a very vulnerable time.
Hey, Rena, we have a question about literacy level for the phrasing in the photonovella. Can you speak to that grade level?
Yeah, so there's two issues. One is readability, which would be grade level. We make sure everything's at the 6th grade level, but or lower, preferably. So every single snippet in those photonovellas has been analyzed for readability. Separate from that, we're looking at health literacy levels, and we use a separate tool for that, for health literacy. Then we look at the Spanish piece, and we don't necessarily just translate from English to Spanish. We make sure that it feels culturally appropriate. The language sometimes takes a different form in Spanish than it does in English. You might describe the same theme slightly differently. And so we try to be careful about readability, very sensitive to health literacy levels, and taking into account possible cultural linguistic barriers, which is, by the way, one of the ways photonovellas have been very successful. When we look at the actual results, we see that members with greater levels of barriers around social determinants of health are actually responding much more to the photonovellas, are taking the time to say, I loved this, it helped explain things I didn't know how to ask, thank you so much. So I think that's something we have been able to address, is the health literacy barrier.
So this is, we had photonovellas that were focused on the pandemic itself, sort of how to stay safe. But we have also moved into a new phase, isn't that right, Rena, which is now much more focused on vaccinations and vaccine hesitancy.
That's right. So, and I think that's, yeah, let's talk more about that. The story continues, and now we're in the vaccine phase within the pandemic. In this map, you see health plan members in Cook County, Illinois, in the Chicago area. And we wanted a very tailored outreach to these approximately 100,000 Medicaid members to encourage them to get the COVID-19 vaccine. But first, if you just look at this map, the map on the left reflects location, where they live. The map on the right reflects how social determinants of health are playing out for these members. And you can see most members are in the orange or red zones, which indicate that social determinant of health factors are contributing to wide health disparities in those census tract areas, in those neighborhoods. On a scale of 0 to 100, where 0 would be very little impact, very low need area, and 100 would be a very high need area, the average for this population was at about an 84. So it was a very high SDOH impact and in a very negative direction. So let's look at the next slide. Running through the approach, we wanted to act immediately with a vaccine campaign, use a survey to understand how members felt right up front, ask them how they felt about getting the vaccine instead of making any assumptions, and then follow up based on those responses with tailored messaging based on what they had shared. So as part of that follow-up, we were using a photonovella to gently nudge or influence their health beliefs and vaccine hesitancy. And the way we did this, the way we designed this, to be clear, is that we followed up only with members who told us that they were unsure or disinclined to get the vaccine. So these were those who were on the fence or non-believers. If they told us they had already received it, we didn't send them the photonovella. It felt like that wasn't the best fit. Instead, we had a couple of follow-up messages reminding them to still be careful, especially around unvaccinated people. And on the next slide, as you can see, about, I think it was, oh no, so here we're actually sharing, sorry, I think here we're actually sharing the photonovella. So Melissa, if you want to speak to that.
Oh, sure. Actually, this is a good place to answer another question that came in, which is, do the photonovellas impact the character count in the text messages itself? So you can see that the way that a member accesses the photonovella over here on the left-hand side, Path Health, that's our imaginary healthcare company, says, hello, this is Path Health. Here's a fun storybook about the COVID-19 vaccine and why you should get one soon to protect yourself and others. click the link to see more. So the actual link to the photonovela is, we use a shortened link there, and so that is the character count for the text messaging. The photonovela itself is accessed once you go through to the link, so it does not impact the character count in the text messaging. So hopefully that makes sense. And the other thing that's nice about being able to structure a program, a texting program around the photonovela, is that you can interact with members using natural language understanding to be able to offer up the amount of content that the member is looking for. So maybe they want to know more, and we are able to offer up more, so we can right size their engagement. Maybe they are happy and that's all they want. That's fine. We don't need to send them anything else either. It also gives us the opportunity to send them links to additional content. Maybe you have a page on your website, or you want to send them to the CDC or something along those lines. And Rena,
Okay, so what you can see, yeah, go ahead.
I was just going to say, part of this was in order to figure out who to message, you were asking people if they already got vaccinated first, correct?
That is correct. So if they had, they could just respond with the word done. And we were surprised at how many people did make the effort to do that. 7.6% of those who were outreached to did respond saying done. At that point, again, they got just a light follow-up saying that's great and reminding them to still be a little careful. But the next slide shows that for those who didn't say done, we asked them some questions in a survey. And there are quite a few questions in that survey. And so we probably won't go through all of those. I think that's on the next slide, Melissa. Yeah, basically what we were doing here, we can leave it up for a minute. What we were doing here was measuring their perceived susceptibility. How likely am I to get this? Their perceived severity, how bad is it? So that we could then influence those, sort of make some adjustments, help fill in some knowledge gaps or health literacy gaps around the severity or even their susceptibility. And this helped us build out that solid picture of where they stood with respect to vaccine. On the next slide, we can see some of those responses. So what you see here is how they responded to the survey. And the blue text on here is the actual question, a statement that they were responding to. And then below that, in the black with the percentages, you can see the percentage who agreed or disagreed or were neutral on that topic, on that question. So we were asking susceptibility, severity. We talked about barriers, benefits, social support, and we asked about side effects. And that was interesting. The largest subgroup on that, we asked about reasons for not doing it, their barriers, and the largest subgroup was side effects. That's the one towards the bottom in the middle. I'm concerned about the following relating to the vaccine. The largest subgroup there was side effects, followed by effectiveness and safety. So we took a lot of this data, and there's another slide in which we share some of their responses to the question, how do you feel? That's the next one. How do you feel about the COVID-19 vaccine? And in this one, we were measuring readiness. And on that, I think that's the next slide, Melissa. On that next slide, you can see that about 60% of those who answered, this question said that they had either already received it, that is one or both shots, or were planning to get it as soon as possible. So this was very positive data and feedback to get. We then, of course, pulled that group out again, just as we had earlier with those who said done, and had some slightly different follow-up messaging, and decided to focus on the others, the ones who were unsure or what we call the on the fence, or the non-believers,
The movable
and
middle.
wanted to see if we could address their vaccine hesitancy.
With the movable middle, I've heard people refer to this as.
Yes, that is right. That's exactly, yeah, that's another very nice way of describing it. Yeah. So in this next slide, you can see how we actually combine that photonovela within a text dialogue. We tell them we'd like to share a storybook. about the vaccine and why they should get one soon. And then we asked them to click. So they're clicking on a link to see exactly what Melissa shared earlier, which is that Fotonovela scrolling down on your phone. And remember, everyone targeted here were identified up front as either members where we didn't know their vaccine readiness, or members where we knew for sure that they did have some level of vaccine hesitancy. So we had already excluded those who were ready to go or had completed it. And as you can see, it's a simple story with two friends who are basically discussing whether to get the vaccine. One of them expresses doubt. She isn't sure she can trust, ... The friend reminds her that Fauci got the first dose months ago. She agrees, and then she acknowledges that actually her doctor and his entire family got it as well. In the next slide, we're actually trying to remind them of the benefits, what they stand to gain if they get this vaccine, back to cooking together with each other and family. And then one of them asks whether it might be expensive. The other replies, oh no, it's free. So we can take care of any potential cost concerns. And then it ends with how there could be a light at the end of the tunnel and a way out of this. The focus is very much on moving towards a more appealing future, not completely like it was, obviously, but hopefully getting there, and getting the vaccine is a big step in that direction. So looking at engagement, we track engagement, of course, and we found that 7.8% of English speakers clicked on the link. What was very interesting here, very striking, was that 3 times as many Spanish speakers clicked on the link. This is particularly significant because we have had more trouble. We've traditionally had more trouble engaging Spanish speakers across almost all the programs that we have launched over several years now. And we're finding that, and this program is a good example, we're finding that using the visual format seems to just draw people in a different way. It's more engaging, we're getting higher response rates, and we're seeing Spanish speakers are more likely to click and also more likely to provide positive feedback after viewing the story. And that's, I think, on our next slide. Yes, in a follow-up after they view the fotonovela, we come back and ask if they enjoyed it. And it's ranked on a 1 to 4 scale. 71% said they loved or liked it. We'd like that to be a little higher. At the same time, we had to temper that expectation because we know that these are people who were disinclined to begin with or unsure. And so given that constraint, the 71% is a pretty solid love or like rate. But then there's an interesting additional follow-up question where we ask them if they're more likely to get the vaccine after viewing the fotonovela. And you can see on the next slide, a word cloud of their responses when we ask them, are you more likely to get it? And you can see yes appears quite prominently in this word cloud. So the question then, and that's on the next slide, is were we able to influence those who were on the fence or had higher levels of vaccine hesitancy? And I think we have a little more detail on that, Melissa, on the next slide, where we find that looking at the actual count of responses, they were 3 times more likely to say yes than to say no. So this is our behavior change measure. This is what we were going after in part. Were we able to influence beliefs? Were we able to influence expected behavior? This is, again, quite significant because it goes beyond just enjoying the fotonovela, saying, yes, I like this way of communication, to saying it's moving into that realm of intention and planned action. And it suggests that we were, at least slightly, able to shift preconceptions and perhaps address some doubts among people who were more vaccine hesitant. So Melissa, you might want to run through a couple of other examples of fotonovelas. I know this has been very COVID focused, because that's been a big part of what we've really wanted to do in this past year, but there are many other examples.
Right. Well, that's the interesting thing about fotonovelas is that it's such a versatile medium. So you're right, Rena, we do have other fotonovelas. This one, for example, is a fotonovela that's focused on NurseLine. So being able to offer NurseLine information to members is often the focus of a lot of, especially new member onboarding, and especially when you're trying to focus on maybe working adults who might be working during the day, who might maybe go to the ER for their care, and also young adults who might not even have a physician. So this is Rena, comments or additional comments about the nurse line photonovela?
Yeah, no, I think that's exactly right. We were actually targeting younger members here who might have just become insured or joined a new plan and who don't quite know about things, services like the nurse line. Yes, it's in your welcome packet. Doesn't mean that you really read that packet. This is just a way of having a story where in this case, he appears to have sprained his ankle. That isn't cause to run to the ER. So we want to just share, and I think the next slide has a little bit more of the story unfolding where he does call the nurse. She says you don't need to visit the ER for a sprained ankle because he's able to walk on it. So she makes him do certain things. So we're trying to show how a nurse can help you self-manage certain types of conditions. Make sure you ice it. We have a nice little image of the ice. Icing and compression will help. And then he says, oh, that was so helpful. So glad I didn't rush to the ER, avoid waiting in line for hours. We're trying to sort of put that in there too. And then he's with his little puppy and he says, you're lucky I didn't blame you, Max, because it looks like this happened while he was running down the stairs and tripped somehow with his little pup. So we try to, when possible, inject a little bit of humor or lightheartedness just so that you feel like, oh, that was kind of a fun story. And I got some value out of it that I might use in the future.
We have another example of a photonovela, but we had a question.
Yeah.
Somebody asking if the photonovela is delivered in Spanish to those with that language preference on their phone. And I believe that language preference is delivered based on potentially language preference in the data file, correct? Not necessarily the device itself.
No, it's what we have in the member data file. So that preferred language field is what we use to determine what the most fitting language is. So yes, if they're Spanish speakers, they would get the same photonovela. And we don't have examples here, but every photonovela we've created has been in English and Spanish so that it can be used across a wide range of members. And that's where we are consistently seeing, no matter what the use case, we're consistently seeing higher levels of engagement with Spanish-speaking members. It was more extreme, more unusual on this most recent vaccine outreach, but they are typically at least a few percentage points higher.
And this photonovela is around telehealth, correct?
That's right. I think they're two friends having a conversation. She's got a headache, she's worried, and a lot of people were. This was actually soon after COVID. I think we developed this one. This was one of our earlier ones too, where a headache could mean so many things. So she was getting a little panicky. The friend said, hey, have you tried telehealth? That was another thing that was springing up in the early days and continues now, where running over to the clinic might not have been the best course of action. And so she's, oh, what's telehealth? And she explains it's something you can do on your phone, but you know what? You can do it on your computer too. The focus here was really on helping people build self-efficacy and be more prepared, build confidence around the idea that they could engage in telehealth, have the right conditions in place. So we're saying, hey, don't reduce noise, close that door, find a well-lit area, make sure your face is visible, so that they're more likely to embark on it. We've removed some of those hurdles or barriers in the process.
And we have a question here. What has the response rate been in the Black and African-American population?
Yeah, that's a really good question. So for one of our clients, they wanted to do race ethnicity-based outcomes analysis. So they actually provided us with that data field. We haven't typically done that. We don't tailor to race, but since that was in the file, we were able to look at the results based on race. And what we have found is the following. This is one where we were targeting, sorry, the light just went off, where we were targeting Latinx, Black, African-American, and white. And what we found was that the most engaged were the Spanish speakers, the Latinx, or the English Latinx population, followed very closely, very interestingly, by Black African-American population. And within that, we found males were actually engaging at a higher rate than females, which is highly unusual. On almost all our programs, we get, in general, more female engagement. So for some interesting reason, this just spoke to, and this was a pretty large population. I think we outreached to over 100,000. This is the one we did together, Melissa. So solid, robust engagement. And they were younger for the most part. These were also young male African-Americans who were engaging at higher rates than their white counterparts, which was quite interesting.
And then we have another question here, Rena, which is, do we have any specifics on engagement or statistics by income level? We've talked a bit about race and ethnicity. The social determinants of health look at income level. Is that correct?
That is correct. So we have developed our own social determinants of health index in-house, which builds on a number of publicly available data sets at the census tract level. And some of the constructs within that index include socioeconomic. So we're looking at income level in a neighborhood, census tract. We're looking at employment rates, insurance rates, percentage of non-English speakers, high school graduation rates. There's over 10 factors that go into the social determinants of health index. And that has now been validated against the community needs index that was created by Dignity Health, as well as average life expectancy measures out there, where we're seeing very strong correlation. And in building this, what we're seeing is with the Fotonovelas that those who are experiencing more SDOH barriers are actually engaging more with the Fotonovela, less so sometimes with text, but more so with text plus Fotonovela. So we're crossing two different barriers here, one on the language side and the other on the social determinants of health side. And that's why this has been a very, very exciting kind of an exploration over the past year, where we are now scaling and building these for all types of use cases.
And speaking of building new use cases, I believe you are working on one now that is meant to drive outcomes around colon cancer screenings, correct?
That's correct. So we're working on, and that's a HEDIS measure. So that's trying to close a gap around colon cancer screenings. And that's, again, a very exciting new area in which we're developing content. And it'll be tailored with several different Fotonovelas based on why people aren't getting that screening. It's very different if it is because you think it's icky and you don't want to deal with it, versus thinking that the fear of the results, not wanting to know, saying, if I have it, I have it. I don't want to deal with it. I'm too stressed. And especially because of COVID, people have put off things. And so I think we're going to have at least 3 different tailored Fotonovelas addressing different barriers that people will share in response to a text dialogue.
Great. We did have a question about how long it takes to develop a new Fotonovela. So excellent timing, person who asked that question, because we have a section on it, how to deploy Fotonovelas. We want to show you a little peek behind the curtain of what we do to create a Fotonovela. Talk a little bit about how long it takes to do it and what kind of a campaign you can build around it to support the Fotonovela. So Rena, do you want to talk a little bit about the creative?
Yeah, I can talk about this. It's actually a very interesting, very creative process. We start with understanding the use case, the target population, the types of barriers at play, and then we create a narrative arc. What's that story going to be? What's the narrative? And we get into a storyboard and work through the process of fleshing out a story that would speak to the member population. I think we might even have an example on that next slide, Melissa, of how we might share different, the look and feel of a storyboard. But before we get to that, who are we targeting? Why? We've done some Fotonovelas. Most of them have actually been Medicaid populations, but we have done a couple with, or at least one that I can think of with dual eligibles, where there was where about a third of them were on Medicare because they were disabled. So it runs the gamut. We have really explored this all ages, I would say, ranging from 18 to 100 at this point, who have engaged with fotonovellas. So, and then across both languages. But the purpose is an important part of the building. What are we trying to do here? Is it to increase utilization? Are we trying to influence behavior? If we're trying to influence behavior, let's build in an uncovering barriers type of text workflow so we can then follow up with the more appropriate photonovella, assuming we have more than one.
And Rena, we did have a question of wondering if we had data on Medicaid versus Medicare Advantage versus commercial. It sounds like we have a little, but we are launching quite a few photonovellas even right now that are going to commercial populations. And I think we have a flu photonovella going out this fall to a Medicare audience. So we'll have a lot more data, you know,
Right.
population against population within the next 6 to 8 months.
Yes, we will. We will have a lot more data. They're all in process. There are quite a few going up.
Yeah.
So you can see here part of that creative process, as I was mentioning, developing that arc, that storyline, fleshing out the story. You see some interesting characters here. We do this to create that mood board to see what resonates with the client based on their population. We then work with the illustrator to create some samples that we again share back. So it's kind of a collaborative process with the client, but we have been doing this long enough that we're able to provide lots of examples right up front, saying this is what we think would work well. What do you think? And again, should we have more than one photonovella for this use case? Should we have 2 or 3 based on barriers or even based on openness to this type of messaging? If we see that a particular subgroup it really resonates with them, let's do a follow-up photonovella a month later to maybe talk about the flu shot. Let's do an early season flu shot photonovella and then come back in the spring and say, hey, did you get it? And then maybe have a separate photonovella that addresses it's not too late. And, you know, maybe themes like doing it for your family, for your peace of mind, just bringing in other themes.
And then Rena, in terms of like the actual turnaround time for creating the photonovella itself, what has it been your experience for that?
It depends on how many. That's an it depends kind of answer. If it's a single photonovella, it goes a lot quicker. Again, if we're tailoring and doing 2 or 3, it takes longer. I would say 1 to 2 months. That seems like a reasonable estimate, depending on scope.
That first one that we did, that was very fast, right? Like
the first one was a couple of weeks. Yeah. It was all hands on deck. Everyone just jumped in to get it done because it was an urgent, pressing issue.
That's right. National health emergency.
Yep.
Yeah. So, you know, somebody asked the question, how do you get people to engage back virtually? And that is a great, the text messaging, the two-way text messaging is the ideal opportunity actually for somebody to engage back virtually. That's where we can ask questions and get answers. That's not so possible really with email or having it hosted on the website, but texting is a great way to have members respond right in the moment. We can even ask them, right, Rena, about you know, if they liked the photonovella, if it changed their attitude or belief.
Yeah, I think people are more and more comfortable with the idea of expressing preferences. And so we might ask them something like, would you like to hear from us more often, less often? We're basically tuning it, making it more relevant, more customized to what they would like. And so we might say something like, hey, just respond more or less or the same. And we get a very high response rate. That particular question has almost a 30% response rate where we're asking, how often would you like to hear from us? Because right there, we've established what their comfort level is, and we can, it might be once a week for one person and twice a week or 3 times a week for someone else. And so we allow for that flexibility by prompting them to just tell us. If it's an open-ended question, like how do you feel after viewing the photonovella, we get a lower response rate. However, we get very rich responses when we get them. So what we try to do is have a mix. We have some structured closed response questions with a 1, 2, 3, 4, yes, no, minimal cognitive load, no effort there to just respond with that 1 or 2 character response. But there are times where we want to ask things like, what's your biggest challenge as a diabetic? We don't want to force them to choose between nutrition, exercise, stress, managing your meds. We want to hear from them. And that's where the natural language understanding comes into play. So if we say, what's your greatest challenge? And they say portion control, we know then that we're going to talk to them more about nutrition because we have the smarts in the system to be able to understand that. So I know that was a long answer, but we try to have a mix to keep them engaged, to make it feel more conversational. We try to have a mix of the closed, simple, easy, almost multiple choice type format versus that open-ended. Tell us how you feel.
Yeah, yeah. And we had another question. This is sort of more tactical in the realm of text messaging. Do members think the link is spam? And I can actually take that one. That is something that sometimes our clients are concerned about. So we are able to handle links in a number of ways. We can use a bit.ly link, which is a link shortener. And we can also brand the bit.ly so that it has the health plan name on it. And so that's just a little extra layer of comfort for the member that what they're clicking on is not spam. Some clients also choose just to use their normal URL that would direct people to a website. But that would be taking a link and providing them, say, back to their website for more information. So the link to the Fotonovela would be a bit.ly link. And the advantage to that is that the bit.ly links can also be we can track member clicks there, and that's another way that we measure engagement.
Yeah, and if we had to quantify that, I would say, and this is an estimate, but about 0.1% of those who respond would say something like, oh, I'm not going to click on this, it's spam. And probably a similar 0.1% of those who respond would say, I wasn't able to click on it. And it could be because there's something with their device. Maybe they've used up the data plan. But that's a tiny, tiny percentage where there's either concerns about the veracity or the source or the endpoint of that link, or an inability to view it. So that's not typically something and that's why I feel like this is something that is so accessible to such a wide audience with really far reaching impact.
And we have another question here, which is this person is curious if this messaging style resonates more than video, and why that might be. What are your thoughts on that, Rena?
Well, it's an interesting question, and that's something we're actually piloting right now. We have the ability, and we're excited about this, we have the ability to be able to link to videos on some of these topics. We're trying to find that sweet spot on what that video length should be. Again, we don't want to place too much of a burden on data plans. We want to make sure you go to the end of it. A photonovela is very quick, but a video can be very engaging and obviously in a completely different way. And so we are in the process right now of doing some sort of A/B comparisons, and you should check back maybe in a couple of months and we'll be able to say a little bit more about it. But we're very excited. We just had our first very large outreach last month to almost 250,000 members in which we are using video. And it's video relating to getting your vaccination and the reasons why. It's just sharing lots of different people talking about why they decided to get it and how they changed their mind. And I think it's quite compelling. So that's something we're exploring in parallel.
Great, great. We still have time for questions. So if folks have more questions that they want to ask, we have been answering all along. Thank you very, very much for the very interesting questions. But we have a couple more minutes here. And it looks like we might be at the end of our questions. So Rena, thank you so much for your insight and your time today. And Patrick, I think I will hand it back to you.
Great. Thank you so much to both of you, Rena and Melissa.
Thank you.
No, absolutely. It was a very valuable presentation, as evident by the great questions you got, right? And as I mentioned before, you've partnered with our members in the past, and we can see here on some of the great results that you've accomplished with those partnerships. So thank you for coming here and sharing your knowledge and your expertise. As I mentioned, Impulse Mobile has been a great partner, has worked with our members to great effect. So we appreciate their continued expertise. As a reminder, everyone, you will receive an email. If you have any follow-up questions or questions about the answers you received, just hit reply. Our presenters are more than happy to engage and chat with you, or maybe some specific things you'd like to talk about later. You have that opportunity. And if you're interested in slides, feel free to ask there. And then, of course, you'll have a link to the presentation. So if you want to share it with your colleagues, you'll have that opportunity. So with that, we're going to close it out. Thank you once again to Impulse Mobile, our presenters, and then of course our attendees. Thank you for your time. Keep a lookout for more of our webinars, our webinar Wisnays for MHPA. Looking forward to bringing you more expertise. Thank you all. Have a great afternoon.
Thank you.
Bye.
Bye-bye.